Oh, when I lied, he does have a phone.
All right. Well, thanks for moving forward anyway. We still have good seats available, floor seats up here if anybody wants to come even closer. Thank you for the introduction. Again, my name is Dave Wales. I'm from Peehip. I'm Peehip's Wellness Program Coordinator. So that just means that my job is to make sure that this wellness program works in the most convenient and most helpful way for all of you, our members. As we get into this presentation, I want you look at our logo here, Team Up for Help, and kind of keep this in your mind, because what I hope you're going to see is that this is really a strong effort from Peehip and our membership to work together to take on and tackle some big challenges going on in our state. All right, so draw your attention to this statistic. Right off the bat, this kind of shows you the urgency of why I'm here, why are we doing a wellness program, why are you hearing so much about it all of a sudden? Well, what this is basically saying, now this is from the U.S. Department of Health and Human Services, is that 7 out of 10 of us are passing away from chronic disease. So we're not talking about things like stroke or cancer, we're talking about slow diseases that are often preventable, that we often can do things to improve and sometimes even heal. And the flip side of that is that 75% of healthcare spending is going towards treating those diseases, and that's because they're normally treated at a very advanced state versus a preventive state. So what we're trying to do together, and the good news is we actually can do a lot, we're trying to team up and we're trying to reverse this trend here in our state and our membership. We're trying to be proactive and we're trying to reduce that suffering in our population. All right, this is just a quick agenda of what we're going to talk about today. Now this kind of looks like I'm going to talk all afternoon and into the night, but I promise it will be quick, but it'll just help you keep a framework in your head of what I'm talking about. We're going to look at the goals of the program, what we're trying to do with this wellness program. Then we're going to look at who's involved, who's eligible, what's involved, what is the wellness program, and then we'll look more at wellness screenings in detail. As you're going to see, we've introduced 4 robust services in our wellness program, but the only one that's currently available right now are wellness screenings. We still have 3 services that are being still worked on, still being fine-tuned and tailored so that when they roll out this coming January, they'll be ready to go to offer the greatest benefit. All right, so goals of the wellness program. Well, obviously, Peehip is trying to help members and their spouses achieve and maintain better health. So that's a preventive goal. Goal number 2 is also a preventive goal. We're trying to increase early detection and identification of chronic disease. So those kind of 2 goals are on a preventive mindset. Number 3 is more of an action goal, and it's saying that we're going to, by outreach, we're going to educate and encourage members towards lifestyles that lower risk factors. And then as we accomplish goals 1, 2, and 3, we're going to accomplish goal number 4 more and more. Now goal number 4 is kind of more abstract. You can't really put a number on it, but what we're excited about is that as we team up and as we make a difference in our Peehip membership, wellness is going to enter people's lives, and it's going to impact not just while they're at work, not just when they go to the doctor for a checkup, but everything you do is going to be impacted by a healthier you. So that's something we're excited about Peehip, is we're really getting to offer some tools that if you take advantage of them, it's going to improve every aspect of your life. All right, now also, as we accomplish those goals, our membership is going to get healthier, and that's going to be less financial strain on a Peehip plan. So what that means is we lower the pressure on Peehip to do one of 2 things that we definitely don't want to do, and that's raise rates or cut benefits. So it's really a win-win situation in that our population becomes healthier, and then the stress on Peehip to raise those rates goes down. So that means that we can keep offering the most comprehensive benefits at the same rate for the longest period of time. All right, now this is the who of the program. This is who's required to participate. And basically we're looking at everybody that's non-Medicare eligible, actively employed, and their covered spouses, but only if you're enrolled in that Peehip Blue Cross Blue Shield Hospital medical plan. So if you're in here today and you're only enrolled in the Viva plan, or you're only enrolled in the optional plans, or maybe the Blue Cross supplemental, you're not required to participate at all in this program. Now if you have any Peehip provided coverage whatsoever, you're eligible for a free wellness screening every year and a free flu shot. That's a benefit that we've offered for quite some time. We're not taking that away. However, if you're enrolled in the Peehip Blue Cross Blue Shield Hospital Medical as an active employee, and your spouse is also enrolled in that policy, then you are eligible and you are required to participate. Now for our retirees, it's all retirees that are non-Medicare eligible. Now for spouses of retirees, it's the same deal, non-Medicare eligible. All right, so we're talking about required to participate. So you're probably wondering, well, what does that mean? Well, the wellness program is a participatory program, and that's kind of outlined in the new healthcare law. You can either be a participation-based program or an outcome-based program. Now, outcome-based programs do things like set all kinds of benchmarks, make you meet certain standards of health, make you make improvements, offer you rewards for meeting those improvements, or give you penalties for not making those improvements. Well, that's not at all what Peehip has done. Peehip has established itself as a participation-based program, so it's actually illegal for us to cross that line into setting any kind of standard for you or requiring any kind of result from you. So everything we're talking about is just participation. There's no standard to meet, there's no result that's required. However, the participation is designed so that it's very easy and potentially offers you great benefit, and a wellness screening is a great example of that. I'm a state employee and I have a wellness program very similar to the one for public education employees, and we have to get wellness screenings every year. And at my office, in recent years, a coworker of mine came in for a wellness screening, had no idea there was anything at risk at all, and was actually referred immediately to an emergency room with a very alarming statistic that came up during that wellness screening. So the participation only took that person about 10 minutes, but the benefit was potentially life-saving. So that's how we've designed this program, is that the requirement from you is very low, however there's tremendous potential upside. All right, so this is the what of the program. This is the components. And there's two things that we're asking all of our eligible members to do, and that's get a wellness screening and then complete a health risk assessment. Now that's a questionnaire. It's going to be available online, and that part's not coming out until January. The wellness screening is the only thing that's currently available now. Now, if you notice up in blue, it's talking about these components having a due date, and we're asking that all our members participate in these programs by May 31st of this coming year. All right, now, this is a second tier of our components. The first tier are the wellness screenings and the health risk assessment, but Peehip will be outreaching to some members for two more tailored services based on some chronic disease and some risk and some gaps in care. Number one is wellness education coaching. That's an outreach service that helps members know and have access to information about ways to live a healthier life. Number four, disease management. Now this focuses on 5 chronic diseases that cause the most trouble in our membership. If you go back to that first slide, talking about the 7 out of 10 of us struggling and passing away with chronic disease, well, disease management is our biggest attack to that statistic. It focuses on asthma, diabetes, coronary artery disease, congestive heart failure, and COPD. Disease management, some examples of that, things like how to self-examine, how to know if there's any issue, when to know to go to the doctor, when to know to go to the emergency room based on how urgent is that issue, adherence to medication, things like that. But this is all outreach services. Again, never Peehip is going to contact you and say, well, you must go to a gym X number of times in a month in order to qualify to keep your insurance. This is all just giving our members the tools they need, and then it's on them whether or not they want to take advantage of those tools or not. All right, so wellness screenings. That's the only thing we have currently available. Those are available in 3 methods. One is worksite screenings here at the school. Those are offered from the Alabama Department of Public Health, ADPH nurses. The nurses are actually be coming here to Piedmont sometime in November. Many of you probably received wellness screenings before. We've offered those in the past. Well, that's the main route. Those ADPH nurses are going to every school building all over the state, so it's a tremendous effort by them. Screenings are also available at your local county health department. Now, if you live close to a county line, you can go to any health department. You're not locked into the one in your actual county that you live in. Now, some of you may get a screening here at school. You may get a screening at a health department, and the nurse may give you a referral form. Well, number one, there is no action required from that referral form. You don't actually have to go to the doctor, but if you choose to, you can do so without paying a copay, as long as you go within 60 days of getting that wellness screening. A third route for getting a screening that we're excited about, Peehip's offering screenings for no copay at your private health care provider. So at your doctor's office, you can go get a screening without paying a copay. Now, the reason for this is you're allowed 1 annual preventive office visit per year at your doctor. So a wellness screening falls into that preventive visit category. Now, it's important to note that if you go in for some kind of treatment, and if you get a wellness screening and then start examining something else going on, you're going to fall into a traditional setup where they charge you a copay for treatment or for a diagnosis. But if you're only going in there to get that screening, then there's no copay charge at your doctor. Now, the doctor's office will fill out that form for you. It's called a healthcare provider screening form. That's what you take with you to get that screening. That form is available on our website. We can also mail them to you. We can fax them to you, email them to you. We can have them available here at the school. But they're available on our website for printout. It's got the instructions for the claim filing so that there's no copay. It's got the instructions for the physician on how to fill it out. So your physician or the nurse or whoever administers that screening at your healthcare provider will fill out that form, and they'll actually mail it off to the Department of Public Health directly. Again, that healthcare provider screening form is available on our website, rsa-al.gov. All right, some of you may have not ever gotten a wellness screening, and I've been talking a whole lot about it, so you're probably wondering what that is. Well, through a quick finger stick, and then it runs through a machine with a little sample of your blood. It identifies all of this criteria right here, this biometric data. It only takes about 5 to 10 minutes to get this done, and these are kind of the tried and true indicators to let you know if there's any risk, any illness, any big red flag going on at that time that you need to know about. Now again, as you look through this list, it's important to remember that no results or no standards are required in this program. So no matter what data comes back on this wellness screening, your insurance won't be impacted in any way. Your premium won't be impacted in any way. Now, some of you may have been reluctant to get screenings in the past because you've been concerned about pre-existing conditions and a screening uncovering a condition which then would keep you from getting that benefit covered for a 270-day waiting period. Well, that's now a thing of the past. There are no pre-existing conditions for any enrollee, for any age, any reason. So that's never anything to worry about with a wellness screening. And now, screenings can only help you get a jump start on identifying and treating something quicker. It can't keep you from having health coverage. All right, so I've talked quickly and we've kind of run through this program quickly, but this is just a quick cheat sheet to run through everything that we've talked about regarding the wellness program. Number one, Peehip is obviously trying to improve the health of our membership by introducing all of these wellness services or components. We're trying to do that by early detection of risk and disease. Number two, no results or improvements or health standards or measurements of any kind are required in this program. Number three, it applies to our non-Medicare members and spouses, if actively enrolled, non-Medicare eligible retirees and their spouses. And number four, the 4 wellness components that we have: the screenings, the health risk assessment questionnaire, the wellness coaching, and the disease management. Now, Peehip will be launching a dedicated website coming in January. Members can log into it. It'll have all kinds of fun, useful health tips, but it'll also let you know exactly where you stand in relation to this wellness program. So you can log in and it'll say you have completed 1 of 2 steps or 1 of 4 steps, or however your progress is in that program at that time. So we will be outreaching to you to let you know where you stand in the program. If there's something that you still need to do by the end of next May, you can expect reminder flyers, you can expect notifications on that website. So we're going to be letting you know exactly at all times exactly what you need to do, because Peehip wants all of our members to participate in this program, because what's going to benefit Peehip the most is our members really taking this program, being engaged in it, and really getting the full benefit out of these services offered. All right, so that's our wellness program. And I'll definitely answer any questions if anybody has any questions about the presentation or about the program in general. Anybody? Again, you can contact us. You can email me, Dave Wells at rsa-al.gov. You can call us. We have a lot of information on our website about the program. And also check out those monthly RSA newsletters, the Peehip Advisor. That's where we put out the most information, the most detail about the program. We also recently launched a Twitter account, so you can get live updates on anything going on there, new developments about the program that way. Well, thank you for letting me come. Thank you for staying after school to listen. And please, again, don't hesitate to contact us if you need to.